Hi, my name is Jansen. I've been the nurse caring for Mr. Jones in room 316. He is a 66-year-old male, and he's been admitted to the ER after experiencing a fall trying to get out of bed. His main complaint is hip pain in his left hip, scored 6 out of 10. The patient was admitted to the ER and has a history of smoking and alcohol consumption, osteoporosis, and depression. Current medications include alendronate 250 milligrams, caltrate 600 plus D3, bupropion 300 milligrams. His allergies are shellfish, nuts, and penicillin. Blood and urine tests were ordered at 5:30 to test for infection, dehydration, and blood sugar, and we're now awaiting the results. Patient expressed that he is fully capable of getting around on his own and is not wanting to comply with fall precautions when education was provided. X-ray of the hip is scheduled for tonight at 10:45, so if you could have him ready and prepared, that would be great. Family member is asking questions pertaining to the fall and why it occurred, and they have concerns that maybe he is onset dementia. Vitals were blood pressure was at a 110/72, heart rate elevated at 125 beats per minute, probably due to the pain. Temperature was 97.9, O2 saturation 96%. We checked his blood sugar upon him being admitted to the unit, and it was at a 54. Blood pressure, patient is a full code and on a regular diet.
Has there been any glucose replacement interventions initiated?
Yes, we promptly gave him 120 mils of orange juice and small amounts of peanut butter.
Awesome.
We are concerned his primary issues right now are possible hip fracture due to injury and his osteoporosis, hypoglycemia requiring prompt intervention. He's also tachycardic, likely due to his pain, anxiety. He's also at an increased risk of complication due to his history of smoking and alcohol consumption and his current condition. Our plan of attack is going to be to continue fall precautions and ensure patient safety. We notified the provider of hypoglycemia and that we are administering appropriate glucose replacement per protocol. We are administering analgesics for hip pain as ordered, and we will continue to monitor vitals and blood sugar closely. We encourage the patient to call for assistance before getting out of bed, and we are currently awaiting lab results to guide further interventions. We're done.
Beautiful. That was good.